Osteomyelitis is infection of the medullary cavity. The most common organism involved is Staphylococcus aureus. The most common involved bone in children is femur. In adults, vertebrae is the most common involved. The most common part of the bone which is involved in osteomyelitis is metaphysis. In metaphysis, the blood vessels are arranged in hair loop fashion. So there is sluggish flow, venous stasis and hypoxia, which results in thriving of the bacteria. Coming to the pathophysiology, there are two phases, acute and chronic. In acute phase, the first 24 hours, there is clinical signs like fever, pain. After 24 hours, abscess is found. Coming to the chronic phase, in 7 to 10 days, there is periosteal reaction and sequestrum is formed. Involucrum is also formed to prevent the spread of infection. The sequestrum is the dead bone. Cloaca is formed when the abscess perforates the involucrum. Sinus is formed when the abscess perforates the skin. In acute phase, the pathological hallmark signs are abscess, clinical signs are fever and pain. Coming to the chronic, the pathological hallmark is the sequestrum and the clinical signs are discharging sinus. Coming to the clinical features, fever, pseudoparalysis can be seen due to the painful joint movement. In investigations, coming to the X-ray, the first change seen is soft tissue edema, which is seen as a lucent, and the first bony change seen in X-ray in osteomyelitis is the disruption, so peristitial reaction. Investigation of choice is biopsy. Coming to the treatment, before 24 hours, antibiotics is started. For 2 weeks, IV antibiotics followed by oral antibiotics for 4 weeks. In more than 24 hours, discharge is done under the antibiotic coverage. In chronic osteomyelitis, the treatment includes antibiotic coverage, sinus tract excision, sequestectomy, curettage, saucerization, and filling the gap with bony tissue or with muscles or skin flap called as myotomy. The complications of osteomyelitis include septic arthritis, which is a surgical emergency, and also destruction of the joint.